All right, so it's roll time. We're talking about supraglottic airway. So let's real quick just know where supraglottic is. Where is supraglottic located?
Above the glottis.
Above the glottis. It's in the name. Supra being above, glottic being the glottis. What is the glottis?
It's a flap.
It's the flap. It's the leafy flap that goes over your trachea. So what's the purpose of that, dude?
Keeps the fluid out of it.
You want to keep it out of the wrong pipe. I don't know if any of your parents said this. My mom said it all the time. I get choked. Must have went down the wrong pipe. Yes, it's actually not wrong. You have an esophagus, you have a trachea, you don't want fluid going down the trachea. So this essentially goes just above that. Now, the way this thing works, and again, I never actually got to use this in the field, so all my training has been either in classroom or through videos, is that this will seed down just right over the tracheal opening, and as you start to ventilate, it will create a suction, and it will seal all the way around. So sometimes if you go too deep or a little too shallow, you may not get a perfect seal, you may not get perfect chest rise to begin with, so you just have to adjust slightly, but all it takes is a slight adjustment, and then it should seal, and then it should work fine from there. So I'm going to go through how to insert it, but let's just talk about the sizes. So you have a 3, a 4, a 5, is that it? Okay, so 3, 4, 5. They have a little cheat sheet here for you. This is all weight-based, 80 to 90 kilograms. So you kind of have to be a little bit of a judge on what you think the size is. You can also kind of go off the height, right? Because weight can sometimes be deceptive to height. I've known some 6'2", 6'3" folks that are 160 pounds. So you really do kind of have to look a little bit at both because the airway is going to be longer. So it's a little bit of a judgment call on that, but this does give you a kind of a baseline to go from. It gives you the weight to look at. So you make your decision on what you're going to use. You get your device out of the package. It's going to be in a sterile package, so you don't want to take this out and then lay it like that. So it's going to be in a case like this. You're going to use some kind of water soluble, which is probably going to be KY. Take this out, and they actually give you this little bitty notch on this dude to put your stuff. The main reason why they really want you to use this is because this is also sterile. It came out of the same package. They don't really want you putting that on the ground and then like being over here on your seat and you're doing this stuff. So there's a purpose to it. And you're going to just go right around the edges of it and kind of get it nice and lubed. And I'm going to tell you something, if y'all don't put some of this stuff on here, these mannequin heads, it ain't going to go down. When you go to insert it, of course you've been bag valving, you've already had your OPA in. So we went through all that process, right? That's a part of your National Registry checkoff. I'm just showing the skills so y'all know. You're not going to hyperextend. If you do the head too far back, on a real person especially, it's really not going to do right. You don't want to go too far forward. So it's kind of the chin just a little bit. It is a slight tilt, a very gentle tilt of the chin going upward. Then you're just going to open the mouth. Now the best way to do this is the scissor technique. You get your finger and your index finger and your thumb, and you just crisscross them. Oh my God, that dude's teeth, what the heck? That may happen. Just take Pepal's teeth out if that happens. So you do a scissor technique. Why are you not going to do the Bassmaster 5000, Savon?
Because you don't want to pinch it off.
The truth is, this dude here, I mean, it may bite down, and unless his teeth are out, then it ain't gonna matter. But if it has teeth in, that could be, now you're stubs. So you don't want to do that. So you just do a little scissor technique, and then straight in with the curvature of the throat. You're just gonna push it down, not like a psycho, where you're just trying to jab it to the bottom, but just nice and gentle till you meet some resistance. Once you meet resistance, you get your BVM, should be hooked up to O2 already, and you just ventilate. Now, what should you do once you start ventilating?
Check for
Check
chest
for chest rise.
Looking for chest rise and fall. What else should you do?
Make sure it's not going in the
Gastric.
stomach.
How? How are you going to know?
Every 6 seconds.
That's true. If you squeeze it too fast or too hard, it will go straight to the stomach. But how do you check?
You can see it, or you can do
First
stethoscope. Listen for breath
Optical
sounds.
tape. You're going to listen for breath sounds, both sides and over the,
Stomach.
which is known as epigastrum. Just teaching y'all some words on it, so you're going to hear the epigastrum. So you're going to listen for any bubbling sounds. You're going to listen to breath sounds. Once you see and hear good breath sounds, nothing over the epigastrum, you can be confident that you're good. If you needed to back it out or move it forward, you're just going to do that gently and then ventilate. It's good to have a partner listening. It's going to help. Once you are convinced this is good, now you've got to secure it. You can do this before or after you secure it. If you want to use this before, it's fine. This is a colorimetric device. You'll need to use one of these things. What does a colorimetric device do, Patrick? CO2, right? So what color should it be? Does anyone know?
Purple. Oh, well, it should be yellow.
Should be yellow. If it's purple, bad. Remember this, a little simple thing. Yellow, yes. Purple, pull it out. You had a
Gold,
comment.
good, purple core is what. Laura's-
Purple pour. Yep. So whatever kind of word association you want to go with, doesn't matter to me. Just know the colors it's supposed to be. And that rhyme, it's like Dr. Seuss, only different. So you connect it, then you start ventilating, right? Okay, so it's good. Either way, you can do it before or after. It doesn't really matter on this part. The securing is what matters next. How you would secure this. Normally on these, there's two little prongs that stick out, and there's like a little strap, and you can just connect that and make it snug. If you don't have that, which some services may not, this one here, I don't know why it doesn't. Use tape. I would use better tape than this stuff, but I'm going to show you how to do it. Take it, wrap it around a couple times, and I go up the face pretty far. Why do you think it's important to go like that? Way up the face, up this way.
Their jaw curvature.
So I'm going to tell
Get
you,
more surface area.
it is common for folks to start having vomiting, be really sweaty, so you want to kind of keep that up out of the mouth line as best as possible. If you don't have good tape, it may not stick anyways, but the game plan is to tape that on, have some good tape. Like I said, it may not stick, it may just break. Okay, so you're just going to put that all the way down. You can edit that later in the edit room. If we had good tape, it would come all the way down. I used to put cloth tape if I was doing this, not this jank tape here. This is low bid, I don't know what to tell you. And then you go back to ventilating. One breath every
5 to 6 seconds.
5 to 6 seconds. Any questions? What's contraindication?
Reflex.
Consciousness would be a contraindication. Gag reflex in particular, with the love of God, CJ, they'll be like, hey dude, this is cool, man. I'm
Just
cool.
relax.
I'm in advance. Trust me. Just trust me. No, don't do that. All right, that's all I got for this one. No questions on it. That is your